Hello, everyone, and welcome to the Viva La Bova podcast. I am your host, Dr. Kara Kwan, and I have a special guest on the episode today. We are talking all about mental health, which is such a big thing, Black mental health. And I wanted to introduce my guest, Jasmine Lamit, to the podcast. She is a social worker and recently wrote a dope book that everyone needs to get, workbook, and it's called the Black Mental Health Workbook. Break the stigma, find space for reflection, and reclaim self care. So, thank you for being on the podcast today, Jasmine.
Yeah, thank you so much for having me. I'm so excited.
And I feel like you could introduce yourself better than I can. So, give the audience a little bit more information about you.
Sure. So my name is Jasmine Lamit. I am a licensed clinical social worker. Been in the social work field for almost 15 years. I've been working primarily with youth and families in the school systems in both Chicago and Los Angeles. I was the director of mental health for 24 schools in Los Angeles for the past 5 years, recently resigned, and I'm transitioning into a new position as a director of mental health for a nonprofit that works with foster youth. I also have an Instagram page called Social Work Sage, where I provide families, mental health practitioners, and schools with tips, resources, a little bit of humor to get through their day. And I also do a lot of public speaking and facilitating workshops on my free time, quote unquote. And I'm a wife and a parent to a 2.5-year-old.
Hey, and I do have to shout out your page, the Social Work Sage. Sorry.
Uh-huh.
Social Work
It's
Sage.
okay.
Because you make the best reels, and I've been wanting to ask you about how to make a reel, but
Oh
you make the
yeah, we
best
got to
reels.
collab.
Yeah, so we do have to collab on that. But yes, they're funny. They are, very creative. So definitely check that out, everyone.
Thank you. Yeah, maybe we can do one to advertise this episode, joint reel.
Ooh, yes, that would be good. Okay, I like that. So let's jump into it. Your workbook, the Black Mental Health Workbook, what prompted you to write this?
Yeah. Well, it's definitely outside of my comfort zone. I haven't written this many words probably since I was in graduate school, which was over 10 years ago. So, it was definitely I enjoyed writing it. But what prompted me, I've been working with the Black community my entire career, in wanting to give back to our community and my own experiences with mental health and what I've seen, how it's impacted my family. And I was contacted by a publishing company actually that follows me on Instagram, and they mentioned that they were looking for an author that could write a book on this topic. So I got over some of my imposter syndrome and decided, you know what, I'm going to give it a shot. In undergrad, I was a psychology and Black studies double major. So a lot of the stuff that I was writing in here were things that I had learned, long ago and had been continuing to read up on and learn, throughout my career. So it was really fun to actually sit down and have time to read articles and studies, which I don't often have time to do in my practice because I'm just go, go, go. And, I've, especially since the pandemic, I've just noticed even within my friends group, within my family, and then certainly in my work, just the increased need for mental health services within our community, and seeing, our people just feeling kind of stuck and not really knowing if therapy was for them or if mental health is something that even impacts us. So just a lot of misinformation and people kind of suffering in silence. So I really wanted to shed light on this topic from my own perspective, recognizing that we all come from different perspectives. Black people are not a monolith, right? There's no one way to have a Black experience.
Yeah.
But to really, be able to break some stigma and to provide a tool for people who are maybe not sure if what's going on for them is normal, quote unquote, or if it's, something that they need to get additional supports for. And I wanted to make it really accessible. I thought about who was the audience for this. I thought about my friends. I thought about the parents that I've worked with over the years. So yeah, I just wanted to kind of shed light on multiple topics to give people just a brief understanding of what what we face in our community.
Yes, and I am so happy that you wrote it. I mean, when I was reading it, I was just thinking like the statistics that you gave were just mind-blowing. I mean, and I even thought about, my practice and being a doctor in an urgent care setting and seeing the patients that I'm seeing and mental health being such a big thing that isn't often addressed.
Hmm.
And just like, what is the you give the history about mental health and psychology and so I think it's such a great workbook to read through.
Thank you. Yeah, as I was writing it, I was, like I said, I was thinking about my friends and family and the parents I've worked
Mm,
with over the years. And a friend of mine was like, she's white, but she's also a therapist. She's like, I think this would be really great for therapists that are not Black. And I was like, I didn't even think about that, but that makes a lot of sense. If you're non-Black, working with Black clients, these are things that you definitely should know and be aware of.
mm.
So I think it can be for anyone, regardless of your race or your profession. So hopefully, it's as a good resource for many.
And I was going to ask that, so I'm glad that you answered it. Is this just for Black people? And it doesn't sound like it's just for Black people. There non-Black people can read this and can get a lot of important information from it.
Yeah, I have friends that are reading it that are not Black and are learning a lot. I have friends that are married to somebody who's Black, who are not Black themselves, who are just wanting to who have like biracial children, right? So really wanting to understand more about our community, and so yeah, it really is for anybody.
Yeah. Okay. So what are the barriers and the stigma that exists within the Black community around mental health?
Yeah, so there's definitely stigma. I have seen it getting better since I started my social work journey in 2008 in Chicago, which is where I got my master's degree. It's definitely getting better, but there still is a lot of stigma. Some of the things that I'll hear, for instance, if a student is referred to counseling in the schools, the parent is like, "My kid isn't crazy," if somebody's feeling really down or depressed, "Oh, you just have a case of the blues." Another favorite would be, Black people, been through so much. Like, you can get through this. You don't need like a therapist or whatever, right? We've been through slavery. We could do, there's a lot of this, mental health doesn't apply to us, right? Or, mental health is for mental illness, or struggling with mental health is for the weak, which is completely just misinformation. And
Mhm.
historically, it's by design, right? In order for slavery to continue and for us to not have all of our civil rights for so long, the people in power had to frame it that we were so strong, we can deal with this. It's not a big deal. Like, we were designed for these stressful environments, which is
Mhm.
obviously not true. But over the centuries, we've ingrained that we have to be strong. We have to, handle things on our own, which, now as time is progressing, we see the impact of that. So definitely still stigma about just even recognizing or accessing mental
Yeah.
health. And then once, the person feels like, yeah, I really want to get some services, or I do want to get some mental health, and there are, barriers with access. Are there BIPOC therapists that are available in your area? If not, has that, non BIPOC person been trained in culturally sensitive or culturally sensitive therapy, or what's really happening within our community from our perspective? And I can tell you from my own grad school experience that you have to be really actively seeking those things out. A lot of grad programs for therapists don't address that the way that they should.
Mm.
And, there's issues with being underinsured or not having insurance. So just many ways that things can get in the way of us seeking therapy.
Mhm.
And, just for myself, as a therapist, even when I'm trying to find a therapist for myself over the years, I can see how challenging that can be. And I'm in the field. So I imagine if
Mhm.
somebody's trying to find somebody, it can be very overwhelming. And then you're just like, oh, I don't want to do it.
Yeah. And I would like to add the mistrust. I mean, I feel like for Black
Yes,
people,
yes.
I've heard it many, many times over where, people come to see me, Black patients that come to see me, and
Yep.
they're like, well, I did not want to come to the doctor at all. I don't believe, I don't like the healthcare system. I just don't
Yeah.
trust it. And so I'm not going to, I'm not going to seek the help that I may need because I don't trust it. Even if
Yeah.
someone looks like them, it's still a trust from a
Hmm.
mistrust from the past.
Yeah, I mean, there's so many examples of this, right? Within the medical field and within the psychology field of using the medicine and using psychology as a tool of oppression, a tool of harm, right? I think of the sterilization of Black women. I think of like the syphilis experiments, all of those types of things, and even just some of the diagnoses that used to exist in the DSM for Black folks specifically, all were a part of a design to continue to keep us oppressed.
Mm,
There's also overdiagnosis in certain things like schizophrenia within the Black community, which speaks to doctors and medical and psychologists, their implicit bias about behaviors that they see within us that they don't apply when they are treating non-Black clients. So yeah, I mean,
mm,
it's definitely valid concerns, and it comes from somewhere, right? And so
yeah,
it's how do we navigate these systems that have not been designed for us and still be able to get the supports that we need.
yeah, yeah. Which brings me to want to read an excerpt from the book that I thought was so well written. And it says, you turn on the news and see another white person has committed an unthinkable crime. They aren't criminal, it's mental illness, says the commentator. Privilege at its finest. But how's being called mentally ill a privilege? For white folks, the mental illness label acts as a get out of jail free card. The label changes the consequences and supports one may receive. It's mind blowing that white people responsible for some of humanity's most heinous crimes are routinely given this excuse, while Black folks are seen as dangerous, threatening criminals before we even made it to trial.
Ooh, yes. Yeah.
I read that like a couple of times. I was like, it's true. I mean, you
Hmm.
see the massive shootings that are mainly from white
Hmm. Men.
white men,
Yep.
and it's usually labeled as mentally ill, not that they're dangerous, but it's
Hmm.
yeah. So
Yeah.
yeah, I was I read that a couple of times when I first read it.
Yeah, I mean, it's there's if I think the perception, whether intentional or not intentional, is that if a white person commits this heinous crime, there has to be some excuse. Like, what was their childhood like? That's an excuse for this. What other things might have happened to this person to make them do this? Versus
Yeah.
with us, it's just because of the stereotypes that exist about our community. It's like, oh, this checks out, right? Like, yes, we expect this to happen for this person to do this thing, right?
Yeah.
Which and it's frustrating. It's really upsetting when when a tragedy happens in our country. Of course, we're impacted by that regardless of the community. And then to see, I have to just turn off the news because I'm like, how long is it going to take for the news commentators to start talking about like the excuses for this person, right?
Exactly. Yeah. And so, we can all say that and agree that racism is bad. And in
Mm-hmm.
your book, you also discuss the impact that racism has on mental health. Can you talk about how racism affects mental health?
Yeah, yeah. So I think a common misunderstanding or misinformation is that racism is only the overt racism that we're all, the KKK stuff or, overt like violent crimes, which of course is racism. But
Yeah.
we often overlook, or not we don't, society often overlooks things like microaggressions and the impacts that those can have. So just those subtle comments that might be one off, but can really, I mean, I think of some of the microaggressions I heard growing up, and those like linger, they haunt you for the
Mm,
rest of your life, right? And that can happen in the workplace and schools all over the place. And then, of course, there's systemic racism. So the systems such as like the way that the mental health system is set up, or schools, or the prison system, all of those definitely impact. And so, when you're experiencing these things on a day-to-day basis, weekly basis, that can impact, obviously, your sense of self-worth, your sense of value, and who you are as a person, which impacts your self-esteem and confidence. That also can lead to depression, right? Feeling hopeless, like if you feel like the world is against you, or you're experiencing, constant, oppression, then you're going to be feeling like, what is the point, right? What is the point of all of this? Like, how can I, be successful and thrive in this environment? And it also can lead to anxiety, right? Just constantly worrying about, going into a new setting, if you're starting a new job, or having to walk into a place that, may be majority white or majority non-Black. And how do I walk into this space and feel safe? And what am I going to expect, right? So those are things, I think even us subconsciously think about, right? If you're going into this new space, like these are things that we often have to do that other people don't.
Yeah. I mean, like, how is my hair going to be for Black women? Are my braids or my twists is that going to be accepted within the corporate, setting, or, so I feel like,
yeah. I know. And there's been even articles about, workplaces that have banned certain type of hairstyles, or schools that have expelled or cut kids' hair at school. Can you imagine that? But that is racism in and of itself. And it can be very traumatic, of course.
Yeah. Yeah. So getting to that, what is the difference between stress and anxiety? And how can someone tell the difference between the two?
Yeah. So I think, for better or for worse, we, as mental health is becoming more of like a buzzword and more, part of just like our dialect in our country. I hear a lot of terms that are just interchangeably thrown around. So like, stressed, or I'm anxious, right? So what is the difference? Like, so, stress and anxiety, right? Having an anxious response is a normal response to an event that is stressful, right? Something that causes you worry, or causes you, causes you worry or causes you stress. So the key word there is it's a normal response. Like most other people would feel stressed out about this. So like you lose your job. Yeah, that's going to be really stressful, right? And you're going through a divorce. That's going to be stressful for most people, right? The difference then between, normal stress and anxiety and like an anxiety disorder is that after this, stressful event has passed, those symptoms of feeling anxiety or feeling stress don't go away. It's just this lingering kind of, can even feel like a low tone that can get really loud at sometimes, but it's just this constant feeling of worrying about things that are outside of your control, thinking about the negative and terrible things that can happen. And it also has to impact your day-to-day functioning, right? So if you have an anxiety disorder or a panic disorder, for instance, it may be difficult for you to do your work, to go to social settings, hang out with friends. It really impacts your life versus when you are feeling stressed or just anxious feelings. You may in that moment not be able to do those things, but once that passes, you're able to recover and continue on with the things that you need to do.
Yeah. And I would say more recently, since the pandemic, I have been seeing a lot more people coming in with stress, anxiety, panic disorder that has not been diagnosed before. People are coming, young people, 21, 30, coming in with, chest pain and shortness of breath. And I'm like, no problems with their lungs, but it's
right.
Once everything else is ruled out, it's like, well, I think that this is a lot of anxiety. Like, what's going on in your life? Who do you want to talk to? Like, we have resources for you. So yeah, I feel like I've been seeing a lot more people with panic disorder, with anxiety, that need help.
Yeah, that needs intervention, right? It's like this is, and it might be exacerbated. I think a lot of people can manage they might have an anxiety disorder, but they have a support system. They've developed coping skills. They've developed, other ways to navigate that. And then sometimes all it takes is a big disruption like a pandemic to exacerbate those symptoms, and all of a sudden, I don't have the tools the tools that I used to use that worked are no longer working, right? And we were all isolated for so long, so that definitely can increase that response to those feelings.
Mm-hmm. Which also brings me to a point where you talk about, I think this might have been like the second chapter, but you talk about resilience and how, like there's certain people or certain communities, racial communities
Mm-hmm.
that experience more resilience and may not even know that they're experiencing resilience. And
Mm-hmm.
maybe if you can give people just like a definition of what resilience means or how you said it in the book.
Yeah. Well, I think about it as like our ability to bounce back, right? So if something happens, we can obviously feel your feelings. Those are all valid. It's like, how are you able to kind of bounce back and move on from whatever it was that happened? And I think about trauma and how resilient we've been with trauma. But I also think that the term resilience has been used against us in a lot of ways. To further oppression and to further just not making changes to benefit people in power, right? So, we don't need to change that. They're so resilient. Look at how strong they are. Look at all they've overcome. And then we also feel like, okay, we have to be strong. We have to have resilience, and resilience can be a huge indicator to overcome traumatic situations, to overcome all of life's stressors. And it's a great tool to have in our belt. And it's okay to feel like you need time to recover from something, to actually go through and process the feelings and experiences that you had. And it doesn't make you any less strong or or make you weaker. And I think that is often a feeling of within our community that I've seen a lot. If you're not bouncing back right away, then there's something wrong with you.
Yeah, which makes me think about, and I think you also said this in the book about Black women and pain tolerance. I know,
Mm-hmm.
within the medical community, that's a big thing of Black women experiencing less pain or being stronger
Yeah.
to experience, having a higher pain threshold.
Threshold. Yeah.
And that's not necessarily the case. So there's certain doctors that don't give the appropriate pain medicines because they feel like Black women can tolerate the pain that they're going through, even though it's like 10 out of 10 pain. So
Right,
yeah.
right. Yeah. And that's often, sometimes intentional, but I think a lot of times it is like this implicit bias, right? It's like they've, through their own experiences or even like through their programs, for school, have just internalize this idea that we're so strong, or that even like not believing us, like that we're lying in some sense,
Mm,
like it must not be that bad, so
yeah.
even just not validating what we're saying is an issue.
And I actually remember a case where I was in residency, saw a Black woman who had a history of sickle cell anemia. And that is, I mean, it's a chronic condition that can affect different
Mm-hmm.
parts of the body and can cause a lot of pain. So there's certain, I remember being on the team and labeling, or other people within the team labeling this patient as a drug seeker, that she wanted to
Wow.
get the opiates and the oxycodone and different things like
Yep.
that because she's a drug seeker. And it's like, no,
Mm-hmm.
she actually has pain. She's like
Right.
writhing in pain, and we're not necessarily doing much about it. So
Yeah.
yeah,
Yeah,
that
those
that
stereotypes, right? Like, well, if they're coming here and seeking these particular types of drugs, they must be a drug addict or like selling drugs or something. It's like, it could be just simple, right? What is it, Occam's razor? No, they actually just have sickle cell, which we know causes a lot of pain, right?
yeah, yeah, and it's just not being well controlled.
Mm-hmm.
Um, yes, I mean I can go on and on about that. Um, so in your workbook, you did bring up a lot of a through line theme of music. you talk about what about your friends, trigger what, say my name, walk it out. Can you discuss that choice and your connection between music and healing in our community?
Yeah. So I'm glad you noticed that. It's something. Music is huge in my life. My dad, I didn't grow up with him. He's passed away, but he was a Jamaican reggae singer, and lived in Jamaica my whole life. And anytime he was on tour, my mom would take me down. I'm from the Goleta area. My mom would take us to Long Beach or to LA to see him in concert. So that was from a very young age. And then I was in marching band and concert band. I played flute. So I'm very like big on music, and it's definitely like a big part of my self-care. Like you can catch me at a concert. I would go every day if I could. I love concerts and festivals. I
Yes.
love it so much. So as I was writing the title headings, I was like, "Ooh, this would be good." And I just wanted to I know that within our community, one of the reasons why we've been so resilient, if you go even back to to slavery, to civil rights, like music has been one of the things that has really saved us, has connected us, has been super healing for us, whether it's, instrumentals or the lyrics, vocalizations, it's all been very connected in our community for generations, for centuries,
Yeah.
even prior to slavery. We go back to Africa, right? It's definitely part of how we heal, how we connect, how we communicate with each other. So I just thought it would be fun to make some of the titles in the book, certain titles of songs, and see if people caught it.
Yes, I like that. Um, so let's move on to trauma. Trauma being a huge buzzword that people use a lot these days. But I don't think many people understand the true definition of trauma and how it impacts not only mental health, but also physical health. So can you shed some light on this topic of trauma?
Yeah. So I'm a certified trauma and resilience practitioner, clinical. So that means that I've been trained to work with youth and families that have experienced traumatic events and help them with healing. And I experienced trauma of my own as a child, as many of many of people do in this country.
Yeah.
So when I was in graduate school and I learned kind of more of like the definition of trauma, I didn't even realize what I had experienced was trauma, And so I'm really big on promoting, advocating for people to understand the definitions and really get the word out about what it is. So trauma, a lot of people have the idea that it's a event at all, right? It's about the experience that you have, the experience and emotions that you have after an event. And what I mean by that is two people can go through the same type of event. So let's say it's two children, and even in the same family, that experienced physical abuse, right? One child might, completely shut down. You might see behaviors at school. You might see them starting to use drugs or alcohol. They have that kind of response to that event. The other student or the other child may completely excel. They might push into school. They might, start a club at their school. They might be seeking out other sources of support and be completely fine, so to speak, right? And so it's not the event of that physical abuse. It was how those two children responded to it. So I think a lot of people will say something like, oh, I went through this particular experience and I was fine. So you're not experiencing trauma. So again, it's great that you were able to respond in that way. There's a lot of factors that can help people respond to trauma in a more, resilient kind of positive way than for others. Having a support system, not having any mental illness factors within yourself or within your family. And so I think a lot of people just don't understand that it's not about us telling somebody what was traumatic for them. If they're telling me that it was traumatic and that's how they were feeling, then that's what we're going to go with.
Yeah. And I guess for for since we're talking about youth, for the youth that we feel are responding negatively to a traumatic experience,
Mhm.
um, how, I guess, do we get the help that they need?
Yeah. So in my former role as the director of mental health, I started a trauma informed schools initiative approach that all 24 of my schools were implementing. It started like 4 years ago. And so a big part of it was raising awareness for teachers and leaders, as well as for families about what trauma is, how it manifests in the classroom. So one of the things you might have, I'm sure you've heard of because you're in the field, but one of so your listeners might have heard of is the fight or flight response, right? And what that is it's really like our response to a stressful or traumatic event. So I share, what that can look like in the classroom, and a lot of teachers don't understand that if a child has experienced trauma, there are trauma triggers that are trauma reminders that can come up in the classroom that will put them right back into that fear and to that state of, needing to get to safety, right? And that can be a sound that reminds them of their traumatic experience. I think of if
Mhm.
they've experienced gun violence and we hear, I don't know, like a car backfire or something like that can bring up those feelings of that traumatic
Yeah.
experience. Or, if they are experience, verbal abuse at home and a teacher is really upset and yells at them in that moment, they can go right back to that traumatic event.
Mhm.
And so that can look like, with fight, flight, freeze, or fawn. Fighting obviously is fighting or aggressive behaviors or even being combative verbally. Flight would be like getting the heck out of there, leaving the classroom, trying to get away from that situation. Freezing is just becoming numb and like kind of not really knowing what to do. And then the lesser known one is the fawn response. And what I realized is like I was the fawn response. That it's more of like, how do I appease the person that's stressing me out? Like, what can I do to to present myself as good, or as
Mm.
somebody that you're not going to want to harm. So let me be like a perfectionist, that kind of thing. So
Yeah.
we see a lot of those manifestations in classrooms, and for teachers to understand it and not take it personally, not like, what is the punishment going to be?
Yeah.
Instead of being like that, it's like, well, what's going on with you? Like, let's get to the bottom of this so that we can provide supports rather than like, here's a consequence for what you just did.
Yeah. And so is that getting your child in to see a clinical social worker, or is it
Mhm.
like getting them into therapy, or I guess
Yeah.
yeah, as a school age child.
Sometimes. So, my big goal with my program was to do a lot of prevention, because a lot of kids, there's
Mm.
levels of intervention, right? And so for some kids, making sure that all of the teachers know the importance of strong relationships, and being that one person in that, I always say to teachers, your goal is to be that one person in their life that is irrationally crazy about them. Like, no matter what they do, like, you're going to be there for them. We want them to have many of those people, but for you, like, that is your goal. Because that in and of itself, when you, I think it was Harvard that did a study on, for kids that have experienced trauma, what was the biggest determining factor about whether they had more of a negative response or able to kind of have resilience. And it was having at least one adult that was a consistent and supportive adult in their life. And I'm like,
Mhm.
wow, if we have like such an opportunity in schools for us to be that person, and hopefully they have
Yeah.
other people in their lives like that as well. So
Mhm.
that's really big. So pushing for relationships. I have a mindfulness curriculum that the kids get once or twice a day, all students that teachers lead. So, filling up their toolboxes with those types of things. We have calm spaces in the classroom. So if they are, we do lessons for all students so they understand, like, if they're feeling elevated emotions, they can put up a peace sign and they can go to the calm space and
Mm.
color or listen to music, right? So those are like our first tier preventative interventions. And then for the kids who like that isn't enough, then we can do like group counseling, or maybe we're going to
Mm.
refer to our licensed social workers or to an outside agency. So like if we have this baseline, we can really target the kids that really need additional support instead of all kids needing, because we don't have enough, right? There's not enough of a therapists to provide treatment for everyone. So we want
Yeah.
to make sure that we're really targeting the kids that really truly need it.
Yeah. Man, I wish I had one of those spaces that when
I
I was
know.
in school, put up a peace sign and go color or listen to
Right.
music. Okay.
And that's what I tell teachers. I'm like, have to lead trainings and things. Sometimes they're 2 hours, sometimes they're 8 hours. And I'm like, when I'm leading trainings for you all, I see some of you like standing up in the back, you go up to the bathroom, like you do different things. And I'm not like, here's your pass or here's the thing that you need. Well, you didn't ask me for permission. You're being able to regulate your needs. Kids need to, like, why would we think that kids don't need to do the same thing? Right. So think
Yeah.
about like what are your needs during the day, and think about kids needing even more of that.
Yeah. And I asked that same question before we move on to the next question. I asked the same question about adults. So if we
Mm-hmm.
see a friend or family member that needs more supportive services since they're not in the class setting,
Right.
um, how can we encourage them to do that
Mm-hmm.
from your perspective?
Yeah. Yeah. I mean, I think it can be challenging. If you are noticing that a friend or a family member isn't, functioning the way that they used to, you're noticing that their mood maybe is lower. I think the first thing to do is to acknowledge that you're seeing that and to come from a place of just support and understanding. And really with an adult, they have to be ready to seek those services. And so for them to just know that you're there and that you have noticed those changes, I think can be a really big step because they may be suffering in silence, right? Not really feeling like they can talk to anybody about these things. And so once you kind of open that door, I always ask, even like with my friends, I have to take off my therapist cap sometimes and just say, like, how can I be supportive of you? Like, what do you need? I think sometimes we make assumptions about what somebody would need based on what we need. And some people need space. Other people, like, I need to be surrounded by a lot of people. That's going to help me feel better. So really asking them what they need. And then there are a ton of resources. If they are wanting to seek services, you can dial 741-741 and text home. And they will provide you with resources in your area for mental health services. They also will just kind of be a person to chat with if you like, I don't really feel like I trust or feel like I have people in my corner to talk about my feelings like that. They have trained professionals that can kind of be a sounding board for you and even let you know, like, hey, I think it might be a good idea to seek some services for yourself. I know NAMI, NAMI, has a lot of resources online for finding mental health therapists, crisis response, drug and alcohol treatment. So the good thing is there are a ton of resources out there. I think, and in my book, I do have a list of like different specific to the BIPOC community, how to get access to BIPOC therapists, because that can also be a challenge. I think the recent statistic was of all psychologists in the country, only 4% of them are Black, which is
4%.
not a lot. 4%.
Wow.
That's psychologists. I think for social workers, there's a lot of social workers that are Black, but there aren't a lot that are licensed like myself because of gatekeeping, right? So the test in and of itself is not designed with us in mind. And they actually recently had to release finally after decades, they had to release the results based on demographics. So our licensing board had been withholding that information because just like we thought, there's a huge discrepancy with specifically white women getting their license and BIPOC folks, specifically Black folks getting their license. So there's issues even within this practice of getting licensed because of bias and all of that.
And what we talked about earlier. Yeah.
Right. Mm-hmm. Exactly.
Okay. Well, I will put some of those resources in the description of the podcast, so you'll be able to reference that if you want to.
Mm-hmm.
So to kind of close out, at the end of your workbook, or you end the workbook with a call to action on reclaiming self-care. So what do you mean by this? And I do want to say that self-care has been pretty, I've talked a lot about self-care on the podcast. I actually just had a OBGYN talking about self-care as lifestyle. So I feel like
I
self-care
heard that.
is also another big buzzword that we've been
Yes.
using. But yeah, what do you mean by the reclaiming self-care?
Yeah. So I think, I have been really excited to see more information about self-care. It's always great when the word is getting out about these topics like mental health or trauma or self-care. But what I have noticed on the flip side, as I've done, workshops for parents that are, primarily Black or Latinx within my schools, is that, I don't have time for that. That sounds like a white people thing. That's like a rich people thing. And I'm like, no, like, let's go back to our origins of like where this self-care term came from. Because, I see on Instagram this quote from Audre Lorde all the time, like self-care is not self-indulgence, right? You see like with a beautiful little design and people share it or it's on stickers. But they often cut out the second part of that statement, which is self-care is not self-indulgence. It's an act of political warfare. I'm like, ooh, okay. Well, what does that mean?
Yeah.
So she, as she was doing all of the civil rights work and feminist work, trying, fighting for our rights that we have today, she recognized how draining it can be to be constantly on the front lines trying to fight for our rights or navigating these systems. And so she was really big, and even the Black Panther Party was really big on self-care and community care. So doing things to like fill our cups so that we still had the energy to fight this fight. And I'm like, oh, that is so powerful to me. So to me, reclaiming the self-care term is like, no, this is not just massages and bubble baths. Yes, you can do that if that's your self-care. But it can be really anything that's going to fill your cup. For me, like if I have the day off sometimes and my daughter's at school, sometimes I want to clean my house. That is my self-care because I feel like I'm not as stressed out when my house isn't cluttered, right? It might be like taking a walk or reading a book or hanging out with a friend, whatever it is, that is self-care. I really think of self-care as self-love in action, right? Self-love is how you think about yourself, like inside your mind, inside your heart. And self-care is like actually taking action to show yourself that you love yourself.
Yeah.
And it helps with our mental health for sure. And I definitely don't always practice what I preach, but my intentions for 2023 was to really get back into, filling my cup. And, I give a lot to others and my family, and I need to also like pour back into myself so I have more to give.
Yes. Yeah, no, I feel you with that. And, self-care has been something that I have slowly come to enjoy and make a part of my life, because seeing patients on a regular basis, seeing people that I want to give, but also can take from me. I feel like yes, and this is for anyone who is out there and is within the service industry. You definitely need to also take care of
for
yourself.
Sure.
With the
or
bubble
even like,
baths and the
parents,
massages, but also, yeah.
I think about parents are a great example of like, service, adjacent, right? You're like, you have to prioritize your kids often. And especially when they're younger, it's hard to find the time. And so, I always, for parents that I've found that are stressed out, who are like, I can't, go get my nails done for an hour. I can't go do whatever it is for you, like a walk, it's, finding that 10 minutes a day, that's just your time. Like whether that's like locking yourself in the bathroom, that's fine. I've done that before, being in your car and listening to your favorite song and just having a moment, like that's better than nothing. And like, hopefully slowly you can build up to other things that you want to work on. In the workbook, I have, a self-care audit, because self-care can come in many different forms, whether it's, your personal self-care, like things that you're doing for yourself to better yourself, or like hanging out with friends, your mental health, physical health, your professional self-care. How are you making sure that you're taking a lunch at work or taking the breaks if you're supposed to do that at your job? So thinking about doing an audit of like, what are the things that I do, and giving you an idea of what self-care can look like. And then there's also a plan in there so that you can really track how you're taking care of yourself and work towards improving that and setting goals for yourself.
Okay. So do you actually have I know you are online, but do you have a community? Well, let me ask about the Black mental health workbook. Do you have a community of people that will, that you want to bring together that are all doing the workbook together?
Yeah, I'm actually thinking about doing that because I've had several people ask me, and I'm like, when I wrote the book, I was just like, here it is out in the world, and I didn't, want to put all my eggs in one basket. But I've thought about doing something. I live in Los Angeles, doing some kind of workshops in starting in February. Some of them in person because I miss in person stuff, and I love facilitating things in person. So yeah, if you're following me on Social Work Sage, as I start, getting more interest in these things, I'm thinking about doing some in person and then also some online support groups so that we can kind of work through some of these things together.
Okay.
Not as your therapist, but as like a support to help you
Yeah.
navigate these things.
Yes, making the distinction.
Right.
Well, Jasmine, thank you so much for coming on the podcast today. I feel like we've had
Yay.
such a fruitful conversation about Black mental health, women's health, or Black women's health. Um, yeah, so I feel like it's been a great conversation. So I thank you for coming on the podcast.
Yeah. Thank you so much for having me. I really appreciate the space and I appreciate the work that you're doing. I love learning more about, my body as an adult woman. I'm like, why don't I know these things? So I appreciate I appreciate that too.
And just let everyone know how they can stay in contact with you, how they can
Mhm.
follow you,
Yes.
how they
So
can
you
get the
can
book, the workbook.
Yeah. Oh, yes. So my book is available on Amazon. So you can type in my name, Jasmine Lamite, or you can type in the Black Mental Health Workbook, and it's available for purchase there. You can also follow me on Instagram at Social Work Sage, and you can go to my website at socialworksage.com if you want to work together or have any inquiries about supporting your organization or anything like that. But I'm available on all platforms.
Okay. Well, again, thank you for being on. And thank you, everyone, for joining me for another episode of the Viva La Vulva podcast. If you like the podcast, subscribe, let your friends and family know, because I'm bringing you nothing but information about women's health, about mental health, about so many aspects that are important to our lives. So thank you for listening. Bye.